I'm with Dr. Sofie Fredriksson from Gothenburg University in Sweden, and she's an audiologist and researcher, and with great interest in the field of hyperacusis. And Sofie, I understand that you will be presenting at the 6th International Conference on Hyperacusis and Misophonia on 1st and 2nd of July, Birkbeck College, University of London. So tell us a little bit about the research study and what's interesting about it.
Yes, so I have been studying preschool teachers for a while during my PhD studies, and this is one of the studies from my thesis where we have assessed hyperacusis symptoms in a very large population. So we did a survey among almost 5,000 responders in preschool teachers and almost as many in the general population. And in Sweden, most preschool teachers are women. So all of our entire population is women. And what we've done in this study that I will present is actually looking at time to the onset of hyperacusis symptoms in relation to occupational noise exposure. So we know from previous studies that noise levels can be quite high in preschools, and the teachers also report screaming from children when you comfort them, for example. They may scream very close to your ear, so they are quite exposed. And so there's been discussions whether it's actually related to increased risk of hearing-related symptoms. So in my previous studies, I compared preschool teachers and the general population, and we found increased risk, for example, of sound sensitivity. We've called it sensitivity to sounds because we only ask one question in our very large survey. So it's about symptoms of disturbance and pain from everyday sounds. And we call it hyperacusis in the study. And what we've done now is actually objectively assess exposure to noise. So we've asked the people to report their occupational history. So from that, we've used a job exposure matrix to objectively assign noise levels to the occupations they've had throughout their history. And in relation to when the onset of hyperacusis symptoms occurs, we've assessed the time to the symptom onset in relation to exposure. And I won't reveal the results, but they are very interesting. Yes.
How fascinating. Yeah, I look forward to listening to your talk and learn from your results. And so based on your studies, so do you think that actually people can develop hyperacusis as the result of noise exposure?
I believe so. I mean, there's been discussions for quite some time about this. There hasn't been super clear studies looking at this in humans, but I mean, most of the research in the animal studies, the experimental studies, actually use noise exposure to elicit hyperacusis-like symptoms or reactions in animals. So I think there is quite a strong, at least hypothesis and assumption that noise exposure can lead to hyperacusis, but there's been discussion on what the actual mechanism is.
Exactly. I think this is very important and of relevance to the clinical practice as well. So in the conference, potentially there are clinicians that will be interested to learn about how these noise exposure and hyperacusis react, because in the clinics we may have patients who've been in accidents, either at work or traffic accidents, and they develop hyperacusis, and it is hard to sometimes to establish the link to say, okay, they develop this hyperacusis because of this noise exposure at work incident, while it's more easier not very easy, but it is more understood and accepted to link the noise exposure to, for example, a hearing loss or even tinnitus. But I think it is for those people who develop hyperacusis as a result of noise exposure, some clinicians may have some sort of a disbelief that this is actually a possibility. So it is great to hear to your talk and your result and see, and specifically that you say one group of people, women, may be more at risk of developing this.
So that's actually what we've seen in the previous studies, that some symptoms may be more likely to occur in certain types of exposures. That's one of our hypotheses. And as you say, we know less about this type of outcome in relation to noise exposure. So it's very interesting. And it definitely needs to be studied more.
Exactly. And I think the gender effect of hyperacusis is something that hasn't been studied hugely. In one of our recent studies, we developed a questionnaire for hyperacusis, and we were, not me, the psychometricians, the statisticians were doing some advanced statistical analysis, which is completely beyond me. And they were saying that there are some trends, that there are some differences in the experience of hyperacusis, or the way that the people respond to the questionnaire items between male and female. And so with the same sort of level of anticipated hyperacusis, for example, females respond higher to certain items of the questionnaire, basically hinting that maybe the experience of hyperacusis is different between male and female. And this is something that hasn't been really explored. Are women more, like, are they generally more sensitive to sound compared to male?
We've just had discussions also in the noise exposure area, because I mean, we know from previous studies that women and men are generally exposed differently, because we usually tend traditionally to have different types of jobs. So that's, in my studies, it's also that component, which is interesting. And I mean, noise exposure and hearing related outcomes are much more studied in traditionally male dominated jobs like industry, because it's high exposure, really substantial exposure. So we know less about the effects of more moderate exposure and this, what we call it, communication intense environments, where screaming, you might not be able to wear hearing protection as much, and you also have a lot of psychosocial stress, which isn't in the long term good for the body, right? Why would it be good for the ears? There's also studies in, for example, Stockholm, there's a group who've done a lot of research on stress and hearing. Maybe that is also a component that is increasing the risk, possibly.
It's very interesting to listen to you and understand this from your perspective, because it is. So I was thinking that maybe there is a gender effect, but listening to you, maybe that gender effect is highly affected by the environment and the type of jobs that they are doing, and
possibly. I mean, possibly both.
Yeah.
We also know from the, I mean, estrogen might have, implications for hearing, developing hearing loss, etc. So it might be both.
Exactly. And after having giving birth, the hormonal changes may already make the person a bit more sensitive to sounds, and that's also another thing, to hear the sound of the baby, if you like, and be more fine-tuned and react to that. It's lots of things to basically learn, and so I look forward to listening to your presentation and learn and discuss a lot of these things.
I look forward to.
Thank you very much for joining me this morning.
Thank you.